A really key component of the training of gender equity professional development is really focusing on developing a shared understanding of what gender equity actually means and developing a shared language that can be used so that everybody that's working in this space is working towards the same end, and that's really, really important. The other thing is understanding why we're doing this work with a focus on gender equity, and because gender is now recognised internationally and all the evidence is telling us that gender inequity is a driver of violence against women. So we want to be building a shared knowledge, a shared professional understanding of the issue, and then also hoping that that leads back into our community. And it's really important that people are using a language that when we do that training, that the language is accessible and it's not exclusive, and that we see that gender equity is something that affects everybody in the community. So really building our knowledge of the issue about how it contributes to violence against women in particular, but also what role it plays in our community more generally when we don't have an equitable community and when we don't have equal and respectful relationships. The first thing is we really want people to understand that gender is a driver of violence, or gender inequity is a driver of violence against women, and we really need to build their understanding of why it's important to foster equal and respectful relationships. And we need to be able to get people to think about the work that we're doing and working towards achieving gender equity and gender equality in our community. We need to get them to think about that with a population health lens, if you like, or a health promotion lens on, which is looking at how do we prevent violence against women before it occurs, and that by actually addressing gender equity and inequities, that we can actually lead to, or that can lead to, a reduction in violence against women. And of course we're working towards the elimination of violence against women. In the work that we're doing, when we're doing the professional development, we're really trying to articulate what are the causes of violence against women, why is it important to talk about addressing gender inequities, and also about how that change is long term, and that what prevention work and preventing violence against women is really different to responding to violence against women. We know we've got huge demands on our response system, and it's a really expensive problem for our community. It takes up an enormous amount of time for police and courts. It's taking up a whole huge amount of work for welfare services, working not just in family violence but in family services and family support services, and our health services as well. So we've got to get people to see and understand that preventing violence against women before it occurs is critical, and the way that we need to do that is by addressing gender inequity. So it's really important that early years providers, and in all types of settings, in childcare services, in kindergartens, whether it be maternal and child health nurse who's actually supporting a play group that's meeting there, that they actually feel confident and comfortable to have conversations with children that they're working with and that they're setting up play environments for, or experiential learning for, that they can explore different gender identities and that they can explore gender stereotypes, and they can look at different types of families, and they can look at the different roles that men and women play in families. So it's really critical that we give them the skills to have those conversations, and that they feel confident to have those conversations, and also that they feel supported in the environment, that they're in the work environment, and not just in the workplace, but also by the people who are supporting them in terms of their funding and their professional development. It is really, really critical that everybody is starting from the same place in terms of their understanding, using the same language, and it doesn't have to be an academic language. We want it to be accessible and we want it to be simple, but that everybody can actually have a conversation, an open conversation, and explore some of these ideas around gender equity. As a Women's Health Service and as a training provider, we can actually support the early years providers in the work that they do, and we can hear from them about some of the challenges that they face, and we can be supporting them to integrate gender equity into their curriculums and to be thinking about what they're doing in all aspects of their service. So that'll be in their play spaces, it's in their reading list for their books and their library collections. It'll be about the types of activities that they offer to the children. It's the dress-ups that are provided. But it's also things like the policy that they have for their own staff and how they do their own staff development. So there's a lot of work that we can be doing together in partnership, because ultimately what we want to be doing is building a community that is actually standing up and saying, look, you know, basically we need to have a more equal and respectful community in order to have a less violent community where women and children are safer. But it's really important that we also support the staff who are working in organisations. We support the parents who are running the committees, because let's face it, a lot of the committees are volunteer committees, so we want those people that are involved to understand why this work is important too. So the training that we do, or the professional development that's going on, has got to be inclusive so that we reach all of those people that are actually involved in delivering our education or supporting the education that our children receive in early childhood settings. It doesn't just benefit women, it benefits everyone. It's benefiting our boy children, our girl children, it's benefiting all of us if we can have conversations and provide experiences for our kids that are about exploring equal and respectful relationships. So I feel really positive about that. And I think that we are starting to have those conversations, and I think professional development in this space is a way of really supporting that work and really underpinning what's going on already.